So today we're going to do a Cryptorchid surgery. Cryptorchid is a animal, patient, horse, etc. that only one or both of the testicles did not descend. On this patient, only one of them did not descend. So where is this testicle? So that is the purpose of this surgery, for us to find that testicle. It could be a high flanker, which has it high in the inguinal region. It could be inside the inguinal region, or it could be in the abdomen. The importance of us finding that testicle and removing it from the body is to limit any other risks, such as testicular torsions, testicular cancer, and also behavior issues. So the doctor right now is going to do a purse string suture. What that is going to do is going to limit the patient from urinating our incision site. Therefore, he's going to put that during surgery, and after surgery, he's going to remove it. It's just to maintain our area as sterile as possible, eliminate the factor of having urination. So I just scrubbed. I'm going to scrub into surgery. We have to be as sterile as possible so that we do not contaminate the incision site. We're going into the abdomen or into the inguinal region, but whatever is the case, we have to do everything as sterile as possible. Therefore, we scrub our hands, we dry them, and then we put our gowns on, and then we put our gloves on. With his fingers, he's going to dissect inside gently and try to find the testicle.
Look right there. So what part is this? What is this right here?
The epididymis?
No.
Is that the ligament, like that holds?
Nope. What's this over here?
That's the dissect, no? There's a muscle.
That?
The muscle. That's
Okay,
muscle.
what muscle is it?
Because I know how to Google now.
No, gubernaculum, I've already destroyed the gubernaculum. It was attached to the end.
Okay.
What's the muscle that attaches to the testicle?
Yeah, the cremaster.
Cremaster. Okay, so hold that
Yes, sir.
there.
This is the testicle.
That's not testicle.
Not yet?
It's vaginal tunic.
Okay.
So we're going to cut that open.
Now open up the vaginal tunic to expose.
We're opening the tunic.
That's
Now
the
what,
epididymis.
now what do we got?
That's the epididymis, no?
That's epididymis, which
Epididymis.
should be attached to testicles in the belly. So we got to open this up some more.
Epididymis. That is the testicle.
No, not yet. We don't get the testicle yet. Keep pulling this. That's testicle. Now, what's the whole key to an emasculator?
Not the nut.
Nut to nut. Crush first. That's the nice part about grinder emasculators. Crush and cut. And then try not to go through the tunic.
Okay.
So the reason for that is we keep
Everything together.
everything's together. And the tunic, if you cut the tunic, it retracts up. So you end up leaving a lot of stuff there.
Gotcha.
And doing them closed, you get most everything out. So let me have that. Just, good.
Beautiful.
Okay.
Sweet. Different doctors have different preferences into closing or leaving the incision open. This doctor prefers to close it because if not, it will close by second intention with granulation tissue. That just takes a little bit longer. Therefore, for the healing process to be quicker and to eliminate risk factors such as herniations, etc., he preferred to close it so that everything just goes as smooth as possible. Cryptorchids are mainly genetic. Therefore, if you're going to breed these horse, there is a high chance that the offsprings are also going to be cryptorchids. That's why we do not recommend breeding cryptorchid horses, and we recommend doing surgical procedures. Having that testicle inside the abdomen, not in the scrotum. What does that mean? It means that the temperature is not going to be the ideal one. Therefore, that testicle is not going to develop correctly just because it's not where it should be. Therefore, it brings a lot of other complications. So that's why we always talk about surgical procedure. The best thing to do on the best veterinary the best medicine would be going to surgery. In surgery, we'll do everything as sterile as possible, and we will find that testicle. On this one, we wanted to do a closed procedure, which what it means is that we do not want to open the vaginal tunic to expose everything that is in there. We want to maintain everything together. What is inside the vaginal tunic? We have the cremaster muscle, we have the vas deferens, we have vessels, nerves, we have the epididymis, we have the testicle. So we wanted to maintain all of that on one region so that we can cut it, maintain everything together, and eliminate the other factors of, hemorrhage, etc. So that was the whole procedure. Everything went smoothly. The patient is now recovering, and yeah, stay tuned.